We don't often talk about templates and our surgical procedure notes, but today we are. So let's chat. Today, I wanted to spend some time talking about those surgical op reports. Hi, Shannon DeConda here with NAMUS. It's not something we spend a lot of time talking about, but today I want to challenge your thought process. Many times we hear a lot of rumble from auditors, coders, compliance professionals alike regarding templates and E&M documentation, as well as copy and paste. And I happen to be an auditor that kind of challenges a lot of those core pushbacks from auditors regarding copy and paste and templates. I'll tell you why. We all use templates and copy and paste in every line and function of business we do. Creating this video, I'm using a template. When I post it, I will use a template. Why is it so wrong that a physician uses a template? An attorney who is creating a divorce, a child custody battle that is so important to us. I've been there, I've done that. That is created with a template. So we get this angst about templates and about copy and paste because of the integrity of the medical record. But the integrity of so much in today's world is created with template and copy and paste. So I want to caution that for just a moment, we pump the brakes and we think about the truest, most vulnerable moment we all go through, which is surgery. We get this huge yikes about an office visit encounter when we aren't under anesthesia, when we are having open dialogue with a physician or a nurse practitioner, PA, or whomever. We have angst over templates and copy and paste in those moments. But when we're under anesthesia and our patients are at the most vulnerable, we look at that documentation, and most of the time we can lay down a surgeon's records and look at them, and they are identical. But you can challenge auditors and coders, and they're like, yeah, they're op reports. Why is that? Well, I understand why it is. If a physician is doing a total knee, a total hip, a gallbladder removal, a tonsillectomy, there's only so many ways you can document those surgical procedures. But also, if I'm a GI physician and I'm doing an exam on a patient before I'm taking them to surgery, isn't there only so many ways I can document the exam of that patient that I'm looking at to do that preoperative evaluation? So my challenge to you is multifold in today's Let's Chat. First of all, let's talk about templates, copy and paste, and op reports. Is that taboo? I don't think so. I think as long as our physicians are updating those op reports as appropriate when appropriate. And I think the as appropriate when appropriate is when it needs to be. If a total knee is requiring a 22 modifier, then my provider needs to document a paragraph and explain why that procedure requires a 22 modifier. That's medical necessity. If a surgery requires a 59 modifier, I need documentation as to why the 59 modifier is required. So those out of the norms absolutely require elaboration to support them. It can't be assumed. It can't be inferred. It needs to be direct and it needs to be clear. So I don't get upset or frustrated when I see op reports that tend to be the same. What does frustrate me is the clinical indications. The clinical indications for the surgical intervention should be patient specific. And I feel like it would be best for patients if we had more than a diagnosis, right? I know that's all that's required, but wouldn't it be best if we had information about that patient that made it more patient specific? Now, the next phase of this conversation I've had with you today, I like to create analogies. For me, that helps me digest things easier. And I think one of the things that I've tried to do in teaching over the years is create those analogies. And that's kind of where I went with today's Let's Chat. As you think about what you allow in these op reports, I want you to take that, and if you allow it in an op report, I want you to kind of challenge yourself as to why you're not allowing that same documentation techniques in your evaluation and management services. Because I have to tell you, if I were a physician in your office, I think I'd be challenging you of, so why do you allow this for my surgical documentation, but yet you don't allow it for my office-based documentation? It really doesn't make much sense. So challenge yourself. Understand why you're not allowing it, because the guidelines allow it. They allow templates provided they're updated. They do allow segments of copy and paste as long as we're not cloning. If you have questions or comments on today's Let's Chat, I challenge you to send them to me or post your comments here. And with that, I'm signing off today, and I hope you'll be back next week. Have a great day.